Hello, I'm Dr. Asavari Manvikar. I would like to welcome you all to the CAR Global Webinar Research Series. Council for Ayurveda Research is an international non-profit organization based out of USA with a sister chapter in India by the name of Ayurvidya Anusandhan Abhiyan Foundation, AAAF. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without the volunteers. So we would love your participation. Consider joining us as a volunteer. We can definitely place you in a variety of projects based on your skills and interest. Once again, our website is www.ayurvedaresearchusa.org. So now let me introduce you to our platinum sponsor, Komal Herbals. It's a company based in Pennsylvania. It is focused on the concepts of Ayurveda and the power of being healthy using herbals and natural products. Komal Herbals work hard to find premium ingredients for their herbal formulations. They also source herbs and spices that are sustainably and organically grown around the world. For more information, go to komalherbals.com. Now, let me welcome you all to our eminent speaker today. Her name is Dr. Dharna Tiku. She graduated from Rajiv Gandhi University, Karnataka, India, one of the prestigious Ayurvedic academics in the world. With a Bachelor of Ayurveda Medicine and Surgery BAMS degree. A few years ago, she worked as an Ayurvedic physician, Vaidya, in Ayush Chennai, a division of Arya Vaidya Pharmacy, a world-renowned hospital and Ayurvedic establishment in Coimbatore, India. She has worked earlier as a senior consultant in Singapore for over 5 years. She has also worked as a medical officer for 3 years in the Department of Integrative System of Medicines, Medanta, the Medicity in India. She has also been a health and wellness consultant over 3 years. She has been treating patients with various disorders, such as PCOS, PCOD, eczema, psoriasis, various skin-related health issues. She also is a trainer cum educator and has conducted Ayurvedic training sessions to the public and has been invited as a speaker. She has conducted workshops at multiple public events to create awareness on Ayurveda, diet, lifestyle, including its importance as a preventive healthcare system. She has recently started her online platform, Aruj Ayur in Singapore, which focuses on building awareness about Ayurveda and online consultation services. Welcome, Dr. Dharna.
Thank you, Dr. Asavari. Thank you so much for your introduction. I am really glad that CR invited me today for this global webinar, and really enthusiastic to go ahead and get along with my talk today. Thank you. Can I share my screen?
Yes.
Just give me a minute. So yes, today's topic, I'm going to talk about efficacy of Patoladi Kashayam in reference to Vicharchika. So I'm again very glad and thankful to Council for Ayurveda Research, US, for conducting such a global, having such a global platform for conducting webinars. And today, my presentation will be one of the add-ons to, contribution towards Ayurveda. Thank you. And I will start with my topic today. So before I start, I would like to declare that this presentation is for the academic purpose to understand methods for critically appraising scientific manuscript. It is by no means to intend or to harm or criticize the investigators or any personnel connected to the manuscript or clinical study. The views expressed here are with sole purpose to be academic. The presenter declares no conflict of interest. Thank you. So for today's aim and objective of the study of Patoladi Kashayam in reference with Vicharchika, because I chose this topic basically because in Singapore, past 13 years in my practice, I have been seeing a lot of patients with eczema and psoriasis condition. And I have come across the effectiveness of Patoladi in my daily practices on OPD basis. So what we will be covering today, I would like to give an overall idea of global statistics and statistics in Singapore about eczema, how eczema has an impact on socio-economic structure of a person, what are the etiological factors attributed to eczema and or Vicharchika, line of treatment in modern medicine, line of treatment in Ayurveda, and followed by Vicharchika introduction, and why we are comparing Vicharchika with eczema or ectopic dermatitis. Later on, we will analyze some beautiful research works and efficacy of Patoladi Kashayam in Vicharchika. I will also present one of my case studies and later on concluding the topic for today. So coming on the statistics of eczema, Singapore and globally, eczema or ectopic dermatitis is the most common skin disorder in Singapore and represents a large clinical burden. National Skin Center Singapore alone sees around 15,000 cases annually, of which 3,000 are new cases. Ectopic dermatitis or AD usually begins in childhood and affects 1/5 of all Singaporean school children. Globally, ectopic dermatitis appears to have a similar prevalence in developed countries and is projected to increase at an annual growth rate of 0.17%, according to a global data in 2014. Epidemiology evidence suggests that ectopic dermatitis affects 15 to 20% of school children and 1 to 3% of adults globally. In Singapore, it is estimated to affect 20% of children and 11% of adults. So this statistics is taken from the Singapore research ectopic dermatitis data. So if we see globally, especially according to the National Eczema Association of USA, the statistics show that 31.6 million people, that is 10.1% in US, have some form of eczema. 1 in 10 individuals will develop eczema during their lifetime, with prevalence peaking in early childhood. Skin disease is one of the top 15 groups of medical conditions for which prevalence and healthcare spending increased the most between 1987 and 2000, with approximately 1 of 3 people in the United States with skin disease at a given time. So how does eczema has an impact or effect on us? Itching is the most common symptom of ectopic dermatitis of eczema, followed by redness and dryness. Skin pain is a newly appreciated symptom of ectopic dermatitis, which has recently been seen, with 61% of affected adults reporting pain. 33% experienced pain at least once per week, and 5.2% had pain daily. Sleep disturbance occurs in approximately 60% of children with ectopic dermatitis. And parents of children with ectopic dermatitis are 4 to 8 times more large to average less than 6 hours of sleep per night compared with caregivers of the healthy children. So it does not have an impact only on the person suffering from eczema, but the family associated with it. Children with ectopic dermatitis often develop other atopic conditions in a typical sequence of food allergies, allergic rhinitis, asthma, known as atopic march. Some of these conditions may persist for years, others may resolve with increasing age. One of the 3 children with atopic dermatitis will additionally develop asthma or allergic rhinitis. The risk of developing asthma increase with atopic dermatitis severity as more than 50% of children with severe atopic dermatitis will develop asthma. More than 20% of adults with atopic dermatitis also have asthma, and they have 2 to 4 times increased risk of having allergic rhinitis and food allergies. Now coming to socio-economic impact. More than 1/3 of people with atopic dermatitis say they often are or always feel angry or embarrassed by their appearance due to the disease. 1/3 to 1/2 of adults with atopic dermatitis avoid social interactions because of their appearance. 1 in 4 children and teens with atopic dermatitis have experienced bullying because of their disease. Nearly 1/3 of adults with atopic dermatitis have experienced challenges in school or their work life, and 14% adults believed that their academic and or career progression has been hindered. So it has an impact on the economic stature of people, as well as impacts their social, has an impact on their social gatherings as well. Now coming to the etiological factors, according to the modern medicine, what leads to atopic dermatitis? According to the Global Epidemiology and Risk Factors, Nutrition and Health Department, Nestle Research Center, genetics has recently been shown to be an important risk factor for atopic dermatitis. Skin barrier impairment could be because of many things, could be because of using harsh hand wash or chemicals on the daily basis. Environmental factors are specific exposure to microbes are also recognized to play a role in the development of the diseases. It could be pollution and other factors. Now coming to Vicharchika, according to Ayurveda, Vicharchika is a skin disease which comes under a broad heading of Kushta. But Kushta in Ayurveda is of 2 types, which is Mahakushta and Kshudra Kushta. Vicharchika is categorized under Kshudra Kushta according to Chikitsa Sthan. It is a Kapha Pradhan Tridosha Javadi. It is mostly predominant of Kapha dosha. It has the impact on Rasa, Rakta, Mamsa, and Kleda, which are the dusha of it. It impacts or it vitiates your lymphatic system, your blood tissues, your muscle tissues, and your kleda. What are the factors according to Ayurveda? What leads to the condition of Vicharchika or atopic dermatitis? According to Charak Samhita Chikitsa Sthan, Viruddhahara means incompatible food, the foods which have opposite qualities. Kledakarahara, food which are too heavy or nourishing. Ajirna Adhyashana, eating food even after having indigestion. Chardi Vega Avroda, avoid whenever there is a emesis, preventing or holding up on the emesis. Ati Vyayama, excess exercise. Ati Santapa, too much of grief, anger. Panchakarma Ati Yoga, excess use or prescription of any kind of panchakarma. Navana, consuming navana, that is newly harvested crop. Dadi, that is yogurt. Matsya is fish. Tilla is the sesame seeds. Lavana is excessive salty food. Masha and Ativyayama. Masha is the black gram and Ativyavaya. So how does it lead to, after following all these nidana, if you're doing the all the things which you are not advised to do and which needs to be prevented for the condition of eczema, if by any, if a person is indulging into it, what happens and how it leads to kushta. So according to Chikitsa, due to various Nidana Sevana, which we discussed in the previous slide, there is prakopa, or there is aggression of tridosha, that is Vata, Pitta, Kapha, which leads to the Shitilata of Twak, Mamsa, Rakta and Ambu. That is stagnation of doshas in Twak, that is skin, muscle, blood and the plasma. Tridoshas get seated in Shitilya Dhatu and V-session occurs. After that, the symptoms of eczema starts. What are the cardinal symptoms? What are the basic symptoms of eczema or Vicharchika according to Charak Samhita Chikitsa Sthan and Sushrut Samhita Nidan Sthan? It's Kandu. Itching is one of the primary symptoms which we will see in most of the eczema conditions. Pidika, that is appearance of the vesicle, boil or pustule. Shavita, discoloration. When there is, when the condition of eczema persists for long, it also leads to the discoloration of the skin. Bahusrava, there is also some of the eczema where there will be excessive profuse oozing. Lasika Srava, Raji, that's marked lining. Ruja, there will be pain. Rukshata, excessive dryness. Now, Vicharchika has a similar clinical presentation as eczema. According to the modern science, eczema shows the symptoms where there's inflammation of the skin, there's scaly or crusty patches of skin accompanied by redness, there's excessive itching, boils of pustule formation, discoloration, hyperpigmentation, profuse itching, lichenification, pain, excess dryness. So these, if you see from the previous slide and this, whatever the symptoms have been discussed in Charak Samhita and Sushrut Samhita are similar to what the modern science also agrees or also has documented. What are the basic line of treatment as per modern medication? Mild to moderate eczema, usually emollients and topical steroids are the mainstay of treatment. If there is moderate to severe eczema, oral drugs and steroidal administration is advised. Eczema is a complex trait with significant genetic and environmental factors influence the morbidity of the disease. So because of all these factors, the basic line of treatment is mostly moisturizing, applying steroidal topical creams and emollients. As per Ayurveda, in Kushta Vyadhi Chikitsa Sthan Charak Samhita, they are different. They have categorized the treatment as per the dosha predominance. Each in eczema, they can be, or Vicharchika, they can be different dosha predominant. For example, for Vata predominant Kushta, where there will be more dryness, more scaling of the skin, medicated ghee is administered internally after assessing the patient. For Pitta predominant Kushta, where there will be oozing or where there will be redness or burning sensation associated, purgation or Virejana therapy is administered along with Rakta Mokshana, which is bloodletting, under the supervision of an Ayurvedic physician. For Kapha predominant Kushta, where there will be more of oozing, discoloration or thickness of the skin, Vamana is advised, which is medicated emesis. So there are two modalities of treatment which are followed. First is Shodhana, which is cleansing treatment, which we also associate with Panchakarma, which is Vamana and Virechana. Also, Rakta Moshana can be added here. Shamana is palliative or pacification of the treatment without interference, without giving Panchakarma. Can be internal medicines, which can be external application of lepa or paste or churna application, rasayana chikitsa, and following the pathya. Pathya means to follow the food, dietary habits, lifestyle, which will help relieve the condition of eczema or Vicharchika. Now, there are also some reference from Chikitsa Sthan where it is completely contraindicated or it is advised not to treat a patient with eczema if they have the symptoms as or if all the three doshas are vitiated. If the patient is very weak, if the patient is suffering from chronic thirst, morbid thirst, or burning sensation. If the patient's digestive strength is very weak, and if the patient have maggots in the patches of kushta. So these under these categories, if the patient falls any of these categories, it is advisable not to treat because it's asadhya vyadhi. It is untreatable or cannot be cured at this stage. Now coming on discussing Patolokatorohanyadi Kashayam, which is our main topic, and its efficacy in Vicharchika. Now, quoting the shloka from Ashtanga Hridayam, which has given the reference of Patolokatorohanyadi Kashayam in treatment or pacification of Vicharchika. Patolokaturohini Chandana Madhusrava Gaduchi Pathanvitam Nahanti Kapha Pitta Kushta Jvarana Vishama Vami Virechaka Kamalam. What it means is Patolokatorohanyadi Kashayam, which is the internal, which is the decoction formation of patola and other herbs, is very effective in diseases which occurs due to kapha and pitta dosha. Skin diseases, it is also effective in various other skin diseases, fever, any kind of toxicity in the body, including poisons, nausea, vomiting, jaundice, lack of appetite, and other liver disorders. It helps in all of these conditions. So Patolokatorohanyadi Kashayam has ingredients of patola, katurohini, chandana, madhusrava, guduchi, and patha. So these are the 6 herbs which are which form the herbal compound of Patolokatorohanyadi Kashayam or Kwatham. So we will discuss about each ingredient of Patolokatorohanyadi Kashayam, and some of the reference from the journals and researches are attached. We will see the scientific modality, scientific relevance of each and every herb here. So patola, this herb contains vitamin A and C, tannins, saponins, alkaloids, peptides, and triterpenes. This plant has apoptogenic, anti-inflammatory, anti-listhymial, chemopreventive, anti-proliferative, anti-hyperglycemic, and anti-hyperlipidemic activity and laxative properties. Katurohini, also known as Katuki in local languages, it has 2 active bitter compounds, picroside 1 and picroside 2. These molecules are known for their hepatoprotective activity and also has impact against toxins. The antioxidant role of this plant was studied by Tiwari and Khan, and I have added the references below. Chandana, also called as sandalwood, commonly known as, it is anti-hyperglycemic, anti-hyperlipidemic. Effect of sandal on diabetes has been reported. It's cardioprotective. It is anti-ulcerogenic property, has also demonstrated in rats. Madhusrava. The roots of the whole plant is mainly used as general tonic or rasayana. This plant exhibits properties like anti-epileptic, hepatoprotective, anti-anaphylactic, and antibacterial. Coming to guduchi or giloy, very commonly used in India nowadays. Some of the active components present in the plants like alkaloids, steroids, diterpenoid, lactones, aliphatics, and glycosides. This plant has wide-ranging medicinal properties like anti-diabetic, anti-periodic, anti-spasmodic, anti-inflammatory, anti-arthritic, antioxidant. It is anti-allergic, anti-stress, anti-leprotic, anti-malarial, hepatoprotective, immunomodulatory, and anti-neoplastic activities. So these are the common medicinal properties, wide medicinal properties of giloy or guduchi. Patha. This plant is used for cramps, gynecological problems, digestive problems like colic pains, poor digestion, constipation. It also acts as a diuretic. Reports on this plant as anti-nociceptive, anti-arthritic, cardiotonic, anti-hemorrhagic, anti-fertility, antioxidant, neuroprotective, anti-diuretic, hepatoprotective, and antioxidant. So I have taken a research work from International Journal of Pharmaceutical Sciences Review and Research, which has conducted a phytochemical and GCMS analysis of an Ayurvedic formulation, Patolka-Rohanyadi Kashayam. In this study, Patolka-Rohanyadi Kashayam or Patham was studied to phytochemical analysis, antioxidant study, and GCMC analysis. This knowledge gained thereby could lead to better evaluation of this medicine at scientific level. We came across the scientific medicinal value of each and every herb. Now we will analyze through this research work how each and every herb in this has the properties as explained in Ayurveda and as per the research works. So this is the research work which I have taken for today's discussion. So coming to phytochemical analysis. So when this phytochemical analysis was done, the materials and methods that were taken were the samples which were taken were Patolka-Rohanyadi Kashayam for a local shop, and the ingredients of the medicines from the herbs in Patoladi Gana of Ashtanga Hridayam were taken as a reference. So preparation of the sample, how the materials and methods were done. About 5 grams of Patolka-Rohanyadi Kashayam sample was taken and dissolved in 50 ml of distilled water, and it was kept undisturbed for 10 hours. Another 5 grams of sample was taken and dissolved in the mixture of ethanol and water in the ratio of 1:1. Raw sample was taken directly for tests. So what was the purpose of phytochemical analysis? The preliminary phytochemical analysis of the herbal medicine was conducted on a raw sample for the presence of the phytochemical analysis was done to assess or to know the presence of alkaloids, saponins, tannins, steroids, flavonoids, anthraquinones, cardiac glycosides, amino acids, triterpenoids, phlebotannins, quinones, coumarin, phenolic compounds, detection of phytosterols. So this preliminary phytochemical analysis of herbal medicine was based on the research works done by Evans, Therese, Editui. After doing the phytochemical analysis, the results revealed that in all the 3 extracts, a raw sample and sample in the distilled water and sample in the ethanol and water 1:1 ratio, phytochemicals like steroids, amino acids, flavonoids, and coumarins and carbonyl compounds were absent in all the 3 extracts, whereas saponin was present in all the 3 extracts of the analysis. Now coming to gas chromatography, mass spectrometry. So this is to identify different substances within the test sample. So coming to these 2 tables, we will discuss about these, the phytocompounds which were found during this analysis. So in figure 1 and 2, some major components were absorbed. Propanoic acid, didecyl ester used as an antioxidant. Piperine, which is radioprotective, immunomodulatory, anti-tumor activities, antidepressant, anticonvulsant, anticonvulsive, and anti-arthritic. In Patola, the role of piperine could also, as it is anti-inflammatory and antioxidant, it also works as a facilitator of bioavailability of other medicines. Ergosterol in Patolka-Rohanyadi Kashayam was found, which has an antifungal activity, and imidazole, which also has an antifungal properties. The presence of compounds which we found in this test, like piperine, ergosterol, imidazole, etc., in Patola clearly indicates that these compounds were found during the preparation of this medicine from the constituent plants. So during the preparation, all these compounds were formed. The presence of compounds like piperine, ergosterol, and imidazole clearly substantiate the medicinal value of Patolka-Rohanyadi Kashayam as claimed by Ayurveda for the treatment of Vicharchika. As we discussed earlier, Patoladi Kashayam has been, as per Ayurveda, has been said as an immunomodulatory, has an impact, works as a hepatoprotective, has an anti-inflammatory properties, anti-emesis. All this can be substantiated with the presence of these compounds. It is of interest to find that medicinal value of each constituent of the plant and that of Patoladi Kashayam match, thus indicating scientific pharmacological efficacy of this medicine. So in this study, this research work which was conducted, we can conclude that the results reveal the presence of compounds like piperine, ergosterol, and imidazole clearly substantiate the medicinal value of Patoladi Kashayam as claimed by Ayurveda. There is a scope, however, there is some scope of discussion here after analyzing the benefits of the compound present in the Kashayam in Vicharchika, that other parameters like pharmacology, pharmacokinetics, and toxicology of this medicine needs to be evaluated more. Now, presenting one of my case studies on the OPD basis, which was conducted in Singapore. So the patient's history was taken, name not to be disclosed, age, she was a 23-year-old female student. And her complaints were blackish discoloration and scaly formation of palmar surface of both hands and around the wrist crease since 3 years. Excessive itching on both the hands and wrists associated with occasional oozing. Currently, she was on topical steroid creams, which keeps itching under control. She has a history of eczema past 5 years. She has undergone various treatment modalities. These treatments have helped her and kept her asymptomatic for 5 to 6 months, after which there was a relapse of condition. There was no any major history. There was no systemic illness. There is no addiction. The socio-economic status was upper middle class. She's not married. No family history of major illness. Her nadi was kapha-vata. Pulse was normal. Mala once a day, but she also had occasional, she used to experience constipated. 2 to 3 times a day, she used to normal urination. Jiha was clean, sparsha was sheath. Her manasik prakriti was rajasic, agni was madhyam, prakriti vata pradhana prakriti. She has sound sleep, but she has a habit of sleeping very late due to her studies. Blood pressure is in the normal range of 110/70. The criteria, subjective criteria, which was taken to analyze the improvement of the patient was itching and dryness. So these two parameters were taken into consideration. 0 being absent and 3 being this severe. So before treatment, the parameters were severe in itching and in terms of dryness. But after treatment, there was seen complete absence of kandu, that is itching and dryness. So what was the treatment modality which was considered here? And I want to make it clear, it was done all on the OPD basis as there are no inpatient facilities in Singapore. So during the first visit, she was advised Thanika Abhyanga, Seka, Shamana Aushadhis were advised. She was advised to follow Pathya during the entire course of treatment. During her second visit, she was advised to undergo Snehapana, Abhyanga, and Virechana. Third visit, she was advised to continue with internal medicines. So during the first visit, Seka localized Abhyanga, Seka with Triphala Kashaya Dara was given twice a day. She was performing it at home, which was, she was instructed how to do that for 1 week. Localized Abhyanga of Nal Pamaradi Tailam 4 to 5 times a day, especially on the affected areas, both the palms and the wrist for 1 week. Internal medicine, choice of medicine, which acted as Shamana Aushadhi was Patoladi Kashayam, 15 ml twice a day. Punarnava Asvam, it is 10 ml twice a day for 2 weeks. Arogyavardhani Vati, 1 tablet thrice a day with meals. Second visit, she was advised after 2 weeks when she came, she was advised Snehapanam with Kalyanaka Gratam with the doses as prescribed for at least 5 days. After 5 days, her Sneha Siddha Lakshanas were observed. And then she was advised for Abhyanga on the 6th, 7th, and 8th with Eladi Tailam. Virechana was advised with 50 grams of Trivrat Lehyam on the 9th day. She had, after that, the Virechana, after having normal Vegas, Samsarjana Krama was done for 3 days. Third visit was after 2 weeks again, where she was advised again to take Kalyanaka Kritam, 10 ml, once a day in the morning on empty stomach for 15 days. Patoladi Kashayam was advised 15 ml twice a day on empty stomach for 15 days again, and Eladi for external application again for 15 days. After 2 months of the whole course of treatment, on the 4th visit, after the above treatment, Patoladi Kashayam internally was advised again for 1 month, and Eladi Telam for external application for 1 month. So, results observed, patient had complete relief from itching and dryness. She was advised for regular Abhyanga with Eladi Telam at least twice a week, even after the treatment was over. After observing patient for 1 whole year, there were no signs of relapse. As we discussed earlier, the patient had undergone various other treatment modalities and treatment procedures, but the relapse was seen after 5 to 6 months of each treatment she was taking. But after giving the above set of medication, there was no relapse for the 1 whole year, and I have still not seen any relapse in her condition. So this was the skin condition during the first visit. If you see on the both the palms and lesions on the hand and the wrist area. This was the second visit where there was mild improvement. Third visit, there was already discoloration observed. And after 2 months, there was no discoloration and the skin was coming back to the normal color and texture. Until now, she is not facing any dryness, but she is definitely advised regular Abhyanga at least twice a week with Eladi Telam. With this case study, I can conclude that non-relapse of eczema in this patient indicates the anti-inflammatory and antioxidant, general tonic, rasayana, and anti-allergic, anti-stress properties of Patolokaturu Kashayam. Since Patolokaturu Kashayam was the medicine given for the longer term after the Shamana and Shodhana treatment were over, I can relate it. Relate it to the effects of Patolokaturu Kashayam. However, the role of other medicines cannot be neglected and need for evaluate and research further on the action of other Ayurvedic formulation is required. However, there were many other medicines which were given during the whole course of treatment. We cannot, blindside the effect of those as well. And a detailed discussion or research on other herbs or effectiveness of other herbs on eczema or Vicharchika can be done. I conclude my topic for today. Thank you, Kar, for inviting me for this webinar. I hope it was informative and helpful, and I have a good day. It's a good morning here. Thank you so much.
Thank you. Thank you so much, Dr. Dharna. It was a wonderful, absolutely amazing presentation. Very informative.
Thank you. Thank you so much. Thank you.
Can you take down this presentation so we can see the participants?
Just a moment.
Okay, anybody has any questions for Dr. Dharna? Thank you. Paradeep ji, Roger, anybody? Yes, please. Can you unmute yourself, please?
Very good morning from India. It's a bit early.
Very good morning.
It was 5:30 a.m. in the morning.
Thank you so much for joining us.
Myself, I will share myself, but I am Dr. Pradeep Kumar. I am professor in basic principles of Ayurveda in some institute in Punjab only. And I was attached with CAR by Dr. Pratibha Shah. Once when it was some survey for COVID last year, I think so.
That's so right. It was a great work. It was a big survey that was created by
I was not involved because I was a bit late that days. I was a bit busy somewhere else. So by chance, I talked with her, and then later I was not the part of that, but I was following that also with my patients. Actually, I have my own Panchkarma center in Punjab, and mostly I visit abroad countries, mostly Schengen countries and Australia and New Zealand. And we are getting abroad patients in India only, in Punjab, at my center, along with my academic job. And I joined this seminar because most of we have got 99% cases of skin diseases.
Very true.
And doctors have given the very good, very informative lecture on this, especially Patoladi Kashayam. We are also using these things that directly the Panchkarma is doing a great part, because when we are giving only Shamana, the patients are getting again and again relapsing are there. And mostly written in the text, our Ayurveda text, that the skin diseases, mostly the Kusht part, which are of varied types. Sometimes, sorry to say, just like Dr. Saab said, that we should avoid the 3 dosha cases. These days, we find only 3 dosha cases. Mostly all are mixed. Sorry to say this, because I can't find the single dosha, which is Vata, which is Pitta, which is Kapha, according to the condition, because our text has been written 10,000 years back.
Yes,
but I see general practice.
Especially looking at the hetus. Yeah, the causes are so many.
Causes are so many, hetus are so many, and all the criteria of living standards and all that dietetic regimens and behavioral activities has been changed. Ahar Vihar has been changed, which has been mentioned in the text. That is what I'm not saying. A heater, cooler, AC, geyser were not there at that time. So we are getting a lot difference, and the herbs also are not of that quality. But we people are lucky that we are getting Keralian medicines from Nagarjuna, Vedaratna, Makatakal now these days in Punjab also. We are getting very good results. So I got attached with this when this was very informative. And I had one case, I could not share the picture on that because I had one case of Vicharchika, which was very marked cuts, deep cuts on the both soul of the female patient of 60 years, having a cardiac problem also. We given her the Vasti Chikitsa for 30 days because I avoided Virechana because of her condition, because of the cardiac problem, the 60 years of age, and a lot of Vata was there. And she was the worst case that she was all the time having mainly stressful condition, which we avoided here because we have to manage the psychotic part also along with in this. Because if the patient has not taken any Nidan or any etiological factor are there, but stress plays a great role in this Vicharchika and all these type of skin diseases because of the secretion of different hormones and enzymes, or according to the body, if we see towards the allopathy part. But this was very informative, very, very informative. I'm very lucky to attend this.
Thank you, Dr. Saab.
We should see the time accordingly. Maybe we can increase the participants.
Yes, of course.
Yeah, very nice.
So I would like to add here for sure, Dr. Saab, what you correctly said. We see mostly the Tridosha is always, each dosha is accompanied with any kind of a condition or disease you see. Because in Singapore, the Hetu, basically the weather and all, is as such that most of the people have eczema. But this patient, which I was sharing with you, I had instructed her, even Singapore, because it's very busy. People don't have time. They will eat anything and everywhere. They just want to run. For her, she had to follow very strict Ahara Vihara, which she did diligently. And with that Ahara Vihara, I would say the relapse was not there for at least, until now. I saw her at least 2 years ago. And until now, the relapse is not there because she is still careful, even though she is able to eat out and everything, but she is very careful of her, food habits, of her lifestyle, and along with the daily or regular usage of Abhyanga. That has helped her a lot.
Yeah, this was an amazing presentation. So I'm just wondering about if you have seen any immediate relief, any formulation or anything that can be used for the immediate relief in Vicharchika, because this
in
can
Vicharchika,
be really challenging.
Yes. In Vicharchika, immediate relief, if it is not exceeded, if it is not a very chronic condition, we can definitely look for Sadhya Virechana. I have also given Sadhya Virechana to many of my patients, especially those who are working in the corporate world. They don't have time for doing Sneha Panam and all. Sadhya Virechana intermittently on the basis of every 15 days or 1 month, seeing their doshas. Along with the topical application of Jatyadi Ghritam has also worked. Jatyadi Ghritam, especially if there is oozing, it is deep cut wounds and all. Jatyadi Ghritam also has a very good effect, giving the immediate relief.
Okay, excellent. Yep. And definitely Panchakarma has a great, that's the most important solution, no matter what kind of herbs and supplements we use.
Panchakarma is, yes,
Panchakarma.
Definitely. And the only thing is here, we cannot observe the patient because here everything is on the OPD basis. We are not allowed to have an inpatient in bedded facility. So the instruction given to the patient has to be very detailed. And during the Virechana, the day of Virechana, I have to be with them on call throughout the day to, guide them throughout because it is new to them. So it is a bit of challenge here because you need to observe remotely a patient. But at the same time, I would say it is not impossible still to do, like Virechana kind of mild purgative processes on the distant basis.
Absolutely. Any other thoughts? Anybody has any other questions or any comments?
I will like to add something like for the immediate relief, we are using Shaddot Gretha, that is having very good application from SKM or other companies. And Mahatikta Gretha Litbam, that is having very good results also. And like Dr. Saab told that Sadhya Virechana, we also use that Nitya Virechana also, very mild with the Swadhisht Virechana Churna or maybe Aragvad Kashayam, freshly prepared daily for the 50 gram. We take that and we make it in the 1 glass of water and make it 1/4. And it is very, very helpful for the skin condition and also especially for the ama. And that is just like doctor told that the Jiva was Sam, means the undigested food particles are attached, and that Aragvada is also very good, which is freshly prepared and very easy to take. Like that, we see it in the commonly that Aragvada is sown in the Indian, agriculture farms, and that is as usual. That is on the roads also. That black fruit, we take that the long stem, that fruit, and we take its pulp and we boil it, and it is very useful and very cheap. And best part is Nitya Virechana with the Ragvat Kashayam. But thanks a lot for letting me in. So I hope for the best in future also.
Thank you, Doctor.
Thank you for joining.
Thank you.
And this is a global webinar, so sometimes it is difficult to find out the time that works for each country. Here actually in United States, it's evening. It's morning for really early morning for India and morning for Singapore. But thank you so much for joining. And if you want to watch any kind of videos, actually we have lots of videos and lots of webinars that we have been conducting for few years. So please go ahead and watch those. You can subscribe our video channel. And if you have any questions, always reach us. It's Ayurveda Research USA @gmail.com.
Thank you so much, Dr. Asaveri, for having me today on this platform.
Thank you.
Thank you.
Have a wonderful day.
You too. Have a great evening.
Thank you.
Thanks a lot, everybody.
Thank you.